as a medical anthropologist, I currently conducting a field work on the consultations of cardiovascular diseases and also Kampo, which is a Japanese traditional medicine, and actually I made a participant observations of consultations. So I'm really interested in how how relationship between doctors and patient work well in that system. So far, actually, the discussions are very great, but actually, I was wondering how to bring these ideas into Japan, because actually, Japan doctor has very strong power, and it's very difficult for patient to deconstruct that hierarchy. So without deconstructing this hierarchy, it's kind of difficult to install open notes in Japanese context. Okay. We call doctors as sensei, which means a teacher or master. So my last name is Isono. So if I'm a doctor, I would be called Isono Sensei, which is a really respected way to call someone. So once you call someone as sensei, we tend to hold back, and we should be humble in front of that person. So in that sense, it's kind of difficult for patients to articulate all kinds of feelings and opinions to doctors. I think open notes are really good, even in Japanese situations. But to make open note work well in Japan, I think patients should know how to make themselves being in the center of their consultations. Because in current situations, just they don't know that they can be a center of the consultation. So I think just telling the existence of open notes is not enough. Before that, I think we should tell patients how to put themselves in the center of their consultations, and they have right to be in that position. Someone made a presentation of the research of open notes conducted in the United States, and I think 12 million people are included, and I'm just amazed because first of all, I thought that it would be impossible to just do that, but actually so many doctors actually participated in that research, so which means that doctors see the benefits of the open notes. So I think because there's a good research in the United States, so it's kind of the good option for me to take that research when I want to introduce the open note to the Japanese people. So this is what I learned from that seminar. I'm not a clinician and I'm not a doctor, but actually I have some classes in my universities, and I'm a teacher at graduate school, and my students were actually experienced clinicians. So actually I can introduce the concept of open notes in my class. And also, because I'm a culture anthropologist, so I'd like to combine the anthropological perspectives into the open notes and make one class. I have great experiences with, there are so many people from diverse countries, and they have all different backgrounds. And actually, I'm overwhelmed with the information from them, but I try to digest. So my experiences in Salzburg is like refreshing my experiences in my life, and I try to reconstruct what I have learned based on the experience on this seminar.